Okay, so today I'm going to be talking about the Joint Commission and the Indiana State Department of Health. So, the goals or objectives are to discuss the history, the national effects of the PT profession, the daily effects on the PT profession, and specifically, I'm going to discuss a little bit about the ortho hospital because that's where I'm at for my first clinical. So, the history of the Joint Commission. It was founded in 1951. It's an independent, not for profit organization, and it is still the oldest and largest accrediting body for healthcare. It is governed by a 21 member board of commissioners, which include physicians, administrators, nurses, employers, quality experts, a consumer advocate, and educators. These board of commissioners will then identify all of the institutions that they're willing to accredit, which will encompass anything from hospitals, nursing care centers, behavioral health care, ambulatory care, home care, and even laboratory services. So, to earn that gold seal of approval, you will go through a survey process every 3 years for all healthcare institutions other than laboratories, which is every 2 years. And these surveys include the commissioner members to come out and ask questions of how each institution is obtaining these standards that the Joint Commission has set forth. Ortho Hospital is actually about to start their surveys for the knees, hips, and spine recertifications. So, the history of the Indiana State Department of Health. It was initially started, and they were only really there to identify births and deaths. But it initially began when legislation was passed in March of 1881, but didn't truly start until January 19th of 1888, because this was the first day that the body actually had their first meeting. So, the mission ultimately is to promote, protect, and improve the health and safety of all the Hoosiers. So, all of us in the state of Indiana. So, now to talk about the macro and microeconomics. So, to define macroeconomics, it is the study of the decisions of countries and governments, which focus on the economic growth and business cycles. Whereas for micro, economics, the study of individual business decisions regarding allocation of resources and prices of goods and services. So, how does macroeconomics affect the PT profession, which is a global effect? And this is really governed more so by the Joint Commission. The Joint Commission sets the standards for healthcare professionals to follow, and ultimately, they're focusing on important patient, individual, or resident care and organization functions that are essential for providing staff with safe and high quality care for patients. So, the Joint Commission also is advocating for the patient safety measures to begin being used more readily, the spread of information, the measurement of performance, and the introduction of public policy recommendations. And then the daily effects of PT are more driven by the Indiana State Department of Health. Ultimately, supply and demand is what drives our daily practice. Like, do we need more PTs to cover the individuals that need care, or is the funding more allocated towards education for the staffing, or for equipment, or education for patients? It is dependent on what we need, when we need it, and how much we have to give ultimately. So, specific to Parkview's Orthopedic Hospital, which is my clinical site, I spoke with the PT director there, and she stated that both kind of encompass why we're driven as PTs at the orthopedic hospital to be better. But ultimately, having the gold stamp of approval from the Joint Commission and having your certifications through the Indiana State Department of Health shows a commitment to a higher standard of service. It provides a framework for organizational structure and management. It provides a competitive edge in the marketplace. It actually enhances staff recruitment because as a PT or any healthcare professional, you want to be held to a higher standard with a higher quality care for your patients. And so, why not obtain a job where you know that you're going to be expected to follow these standards? It's also recognized by insurers more so then you get more patients that are able to be covered within your care. And ultimately, you're providing a standardized care, improving outcomes, and reduction in costs. So that's the key. But this is all I have. So if you have any further questions or need to know a little bit more, I've provided the links, and that'll be all.